Our investment at Austin Travis County Integral Care in mental health first aid was really recognizing this groundbreaking public education program as allowing us to partner with the over 1 million Austinites in helping themselves, and helping each other, and helping those with behavioral health needs. We know the prevalence of mental illness is such that 26.2% of any adult in the United States will be diagnosed with a mental health disorder. And it's going to require everybody, just like with CPR and first aid, to have the knowledge and skills to identify the early signs and symptoms, to be able to offer somebody assistance who's in psychiatric crisis, and to know where to link those individuals to the needed services. Everyone needs to know mental health first aid because mental health problems are real, they're common, and they're treatable. People often ask, if you were having a heart attack, what city would you want to be in? People answer, Houston, Texas, Chicago, because there's world-class cardiothoracic surgeons in those areas. But if you never survive the journey to the hospital, it doesn't matter. With mental health first aid, it's analogous. If somebody's having a panic attack, somebody's experiencing a first episode psychosis, it's going to require somebody in their vicinity to recognize that and to offer help. We've got a limited number of mental health professionals. Individuals with mental illness are fearful because of stigma to reach out to services, and sometimes because of their illness lack the insight as to what's really going on with them. Mental health first aid has profoundly changed our community. One of the first groups that came to us was the Austin Public Library System, because they recognized that many of their patrons were struggling with illnesses that their staff didn't know what to do with. And so almost invariably they'd call 911 and have law enforcement respond to what was purely a mental health issue, nonviolent. To their credit, they participated in mental health first aid and as a result changed their policies. So instead of calling 911 and having the police respond, they call our mobile crisis outreach team and get people linked to appropriate services. In our housing community, both public and private groups used to, again, not understand what they were dealing with in their residents that were struggling with mental illness, and not uncommonly would end up evicting them to homelessness. By training them in mental health first aid, they join us as partners in serving those with behavioral health needs and keep people in their homes and get them access to treatment.